pancreatic cancer is a formidable threat that too often goes unnoticed until it's dangerously advanced. In fact, according to the American Cancer Society, pancreatic cancer has one of the lowest 5-year survival rates, hovering around 10%, which is a sobering reflection of how silently this disease progresses. The real danger lies in how difficult it is to detect early, as the pancreas itself sits hidden deep within the abdomen, offering little clue when something begins to go wrong. Yet these realities underline exactly why awareness can be life-saving and why it's crucial to recognize symptoms before they escalate. If you or someone you love is concerned about pancreatic cancer, pay close attention to the warning signs because identifying them early could truly be the difference between life and death. Before we uncover 8 of the most shocking symptoms of pancreatic cancer, please take a moment to like this video, share it with anyone who might benefit from this information, and subscribe to our channel for more in-depth, research-driven insights. Your engagement not only helps us spread important medical knowledge, but can also help countless individuals who might not otherwise realize they need this information. That small action supports a chain reaction of awareness that ultimately could save a life. Moving forward, the conversation will delve into the subtle changes in your body that may indicate pancreatic cancer long before it reaches a critical stage. We'll explore how persistent abdominal pain, unintended weight loss, and other early warnings set off silent alarm bells. These often overlooked signs can be powerful clues, and while it's not wise to panic at the slightest symptom, it is important to note any shifts in your health patterns, especially changes that seem inexplicable or coincide with each other. This script draws on reputable research from institutions such as the National Cancer Institute and peer-reviewed medical journals, aiming to provide you with authoritative, accurate information. The focus now is on weaving these findings into an engaging, relatable narrative so that you can understand how serious this condition is and how it can creep up without obvious signs. Let's shine a light on what might be hiding in plain sight, beginning with those early indicators that many people accidentally brush off. Stay with us because what you'll learn next might be the key to catching this illness at its most treatable stage. The earliest symptoms of pancreatic cancer can be hauntingly subtle, and many people attribute them to common digestive upsets or stress-related issues. One of the most frequently reported early signs is a persistent, gnawing pain in the upper abdomen that sometimes radiates toward the back. While occasional digestive discomfort might be nothing more than heartburn or random cramp, continuous pain that refuses to subside, especially if it worsens when lying down or immediately after meals, warrants a closer look. Research suggests that this particular type of discomfort stems from the location of the pancreas deep in the abdomen. As a tumor grows, it can press on surrounding tissues, prompting that nagging, sometimes dull, sometimes sharp sensation. Imagine feeling a pain that creeps in gradually, but insists on staying for days on end. This could be a nudge from your body, urging you to get it checked. Another early sign that many people overlook is unexplained weight loss. We're not talking about dropping a few pounds after changing your diet or exercising more. Instead, it's the sort of weight loss that catches you off guard, where you aren't intentionally modifying your lifestyle, yet find yourself losing 10 or 15 pounds in a relatively short span. The pancreas plays a vital role in producing enzymes that help break down food. When a tumor disrupts enzyme production, digestion can be thrown off balance, leaving your body struggling to absorb essential nutrients and energy. Suddenly, you might feel weak, fatigued, or simply less inclined to eat, which further contributes to the weight falling off. Doctors sometimes call this a red flag symptom because, in conjunction with other signals, it can suggest deeper issues that demand investigation. One particularly striking warning sign is jaundice, a yellowish discoloration of the skin and the whites of the eyes. This occurs when bilirubin, a compound produced as the body breaks down old red blood cells, builds up in the bloodstream instead of being flushed out by the liver. In the context of pancreatic cancer, tumors located near the head of the pancreas can block the bile duct, preventing bile from flowing properly, and leading to that telltale yellow hue in the skin and eyes. It's worth noting that this blockage can also give rise to darker than normal urine, itching, and paler stools. This triad of symptoms signals a potential liver or biliary problem, but doctors often run tests to check whether the pancreas is also involved. On the topic of stool changes, it's vital to pay attention to any persistent alterations in color, consistency, or smell. If you observe that your stools appear greasy, float, or are strangely pale, it may be a sign of malabsorption, often linked to pancreatic enzyme insufficiency. Research published in the Journal of the National Cancer Institute indicates that when the pancreas doesn't produce enough enzymes or when the bile duct is obstructed, your body struggles to break down fats, resulting in stools that look oily and are difficult to flush. While stool changes can arise from a range of conditions, including gallbladder issues or irritable bowel syndrome, persistent or pronounced alterations should lead you to consult a healthcare professional, especially if they coincide with other symptoms mentioned. Picture yourself noticing these changes one by one, a mild pain here, a surprising drop on the scale there, maybe a faint yellowish tinge in the mirror, or a stool that looks odd. It can be easy to rationalize each phenomenon in isolation, chalking them up to stress, a new diet, or perhaps even mild dehydration. However, it's when these symptoms cluster together that they become more alarming. Experts often emphasize that pancreatic cancer's silent nature lies in its ability to hide behind relatively innocuous symptoms, which is why staying vigilant and acknowledging the subtle cues your body sends is so essential. If you have even a small suspicion, reach out to your medical provider because early investigation can make all the difference. Now that you have a clear understanding of these initial red flags, abdominal pain, unexplained weight loss, jaundice, and changes in stool, it's time to zoom out and see the bigger picture. While these manifestations can appear in the earlier stages, pancreatic cancer evolves, bringing with it a range of advanced symptoms that can be even more concerning. Yet not everyone experiences the illness the same way. Some people skip the initial warning signs and jump straight to more pronounced indications. In the next segment, we'll examine these more severe symptoms, their impact on daily life, and how crucial it is not to disregard them. Awareness is key, and you'll soon discover that knowledge of these signs can be a literal lifesaver. Advanced symptoms of pancreatic cancer can be startling, even frightening, particularly because they often emerge after the illness has had time to take hold in the body. One of the more unexpected indicators is the sudden onset of type 2 diabetes in individuals who previously had normal blood sugar levels. The pancreas, after all, is responsible for producing insulin, the hormone that helps your body regulate glucose. When a growing tumor interferes with insulin production, blood sugar spikes can occur, leading to classic diabetes symptoms such as excessive thirst, frequent urination, and fatigue. Several studies have pointed out that adults over 50 who develop an unexplained case of diabetes, and especially those whose diabetes is hard to control with conventional medication, should consider undergoing screening for pancreatic issues. Speaking of routine bodily functions, another advanced warning sign may involve stark changes in urine and stool color. Dark urine resembling tea or cola can result from excess bilirubin that the body can't properly eliminate due to a blocked bile duct. Conversely, stools might turn even lighter than before, indicating that bile, which normally gives feces its brownish color, isn't reaching the intestines. These shifts can appear quite suddenly, and while they might be attributed initially to dehydration or diet changes, a consistent pattern suggests something more complex is at play, coupled with other signs like jaundice or upper abdominal pain. Dark urine and pale stools are strong indicators of a significant blockage in the hepatobiliary system, something doctors tend to investigate rigorously if suspected. Patients also frequently report fatigue and persistent weakness, which, while broadly common in many illnesses, can be especially pronounced in pancreatic cancer. Cancer cells tend to consume a lot of the body's energy and nutrients, leaving less fuel for normal bodily functions. This is compounded by the fact that if your pancreas isn't producing enough enzymes, your body is less efficient at breaking down and absorbing the nutrients from your meals. Over time, even simple tasks like walking up a flight of stairs or completing household chores can feel laborious. According to the American Cancer Society, up to 70% of people with cancer experience fatigue as an early or mid-stage symptom. This constant sense of exhaustion often worsens if accompanied by chronic pain or difficulty sleeping. Nausea and vomiting also enter the scene when a tumor in the pancreas presses on the stomach or partly blocks the digestive tract. These symptoms can be mild at first, perhaps leading to occasional queasiness or an unsettled stomach after meals. But in advanced stages, nausea and vomiting can become more frequent and intense, contributing to a vicious cycle of malnutrition and weight loss. As the tumor expands, it can create blockages that make it physically challenging for food to pass through the digestive system. Such gastrointestinal turmoil can become profoundly disruptive, impacting not just physical health, but also emotional well-being, as meals that once brought pleasure now symbolize discomfort and worry. It's crucial to realize that these advanced symptoms often mean that the cancer is more widespread, or at least more firmly rooted in the pancreas and surrounding tissues. For many, discovering the illness at this stage drastically limits treatment options, highlighting again the importance of catching it early. However, while these signs are indeed alarming, they serve a purpose. They can push individuals to seek medical help, where scans, blood tests, and other diagnostic tools might finally reveal the underlying problem. What's equally important is understanding that these symptoms aren't always unique to pancreatic cancer, but their combination and persistence are red flags that shouldn't be brushed aside. Recognizing that the disease has a stealthy approach, the next step lies in appreciating why timing is everything. If you notice even a couple of these advanced symptoms, or if they build upon the earlier signs described, acting swiftly can be a matter of life or death. Coming up, we'll talk about the vital role early detection plays, from boosting treatment success rates to improving overall quality of life. Remember, just because a symptom can be explained by something else doesn't mean it should be ignored in the context of potential pancreatic issues. Knowing the possibilities empowers you to advocate for your health in a more informed way. Understanding why early detection matters in pancreatic cancer is essential when considering the gravity of the disease's typical trajectory. As we've seen, the symptoms can be vague at first, ramping up over time, which often allows the illness to progress without interruption. By the time many individuals realize something significant is amiss, the cancer has already spread to surrounding organs or distant areas of the body, drastically narrowing down treatment possibilities. According to the National Cancer Institute, localized pancreatic cancer, that is, cancer confined to the pancreas, has a 5-year survival rate that is markedly higher compared to cancer that has spread to lymph nodes or distant organs. This difference underscores the life-saving benefit of catching the disease in its early stages, when surgical removal of the tumor may be most feasible and additional therapies have a greater chance of success. Diagnosing pancreatic cancer generally involves a combination of imaging tests, blood work, and sometimes a biopsy. Common imaging modalities include CT scans, MRIs, and endoscopic ultrasounds, which allow specialists to see the pancreas in detail and detect any suspicious growths. Blood tests might measure levels of CA-19-9, a tumor marker often elevated in pancreatic cancer, though it isn't universally high in every patient and can be elevated in other conditions too. Yet these tests together can paint a more complete picture, guiding doctors to decide whether more invasive procedures, such as a biopsy, are necessary. Early detection hinges on recognizing symptoms early enough to warrant these evaluations, and that's precisely why being informed about the warning signs is critical. Still, what truly makes a difference is how quickly one acts upon noticing potential indicators. If persistent abdominal pain, unexplained weight loss, or a sudden case of diabetes feels out of the ordinary, scheduling a checkup shouldn't be delayed. Doctors often say, if something feels wrong, trust your gut and get it examined, because a proactive stance can fast-track diagnosis and potential treatment. Caught early, surgical interventions like the Whipple procedure, which removes the head of the pancreas, part of the small intestine, and sometimes portions of other nearby structures, can offer a fighting chance at long-term survival. Chemotherapy and radiation are also more effective when the cancer hasn't had the opportunity to establish satellite tumors throughout the body. Moreover, early detection can significantly improve a patient's quality of life. Even if surgery isn't an option, starting treatment promptly may relieve some symptoms, prevent complications such as severe jaundice or bowel obstructions, and help maintain nutritional status. This in turn can preserve strength, energy levels, and overall well-being, enabling some semblance of normalcy during the treatment process. Ignoring worrisome signs or brushing them off as routine aches and pains can allow the cancer to tighten its grip, making any form of therapy more challenging and less likely to yield positive outcomes. This emphasis on early detection points to the next question: what can you do right now to reduce your risk or support someone who might be vulnerable? While none of us can control every aspect of our health, there are steps we can take, from lifestyle adjustments to regular checkups, that can stack the odds in our favor. Having laid out the case for urgency and vigilance, we'll bring it all together by discussing simple yet impactful measures that can make a difference, along with a final reminder of why spreading awareness is so important. Remember, even if you never need these measures yourself, sharing them might help someone else recognize a symptom that could save their life. Before we wrap up, let's quickly recap the 8 critical symptoms of pancreatic cancer: persistent upper abdominal or back pain, unexplained weight loss, jaundice, changes in stool, greasy or pale, new onset type 2 diabetes, dark urine, pronounced fatigue, and recurrent nausea or vomiting. Each of these symptoms on its own can be dismissed as something minor, but their combination or persistence might signify something far more serious. If you notice multiple signals from this list, or find that one of them persists and intensifies, consider consulting a healthcare professional without delay. Pancreatic cancer is deadly precisely because it's elusive. Hence, every day counts when it comes to recognizing and responding to early or advanced warning signs. While genetics and other uncontrollable factors sometimes play a role, there are lifestyle choices that may reduce the risk. Maintaining a balanced diet filled with fruits, vegetables, whole grains, and lean proteins supports better pancreatic function. It also helps to avoid or quit smoking, since studies consistently link tobacco use with a higher incidence of pancreatic cancer. Regular exercise, even moderate physical activity like brisk walking, can strengthen the body's immune system and improve overall metabolic health. Monitoring and managing blood sugar levels, particularly if you're at risk of diabetes, can also play a part in reducing stress on the pancreas. And don't neglect regular medical checkups. Routine blood work and imaging, if indicated by your medical history, can catch anomalies earlier than you might on your own. As you reflect on this information, remember that sharing knowledge is a powerful step toward prevention. Please pass this video on to anyone who could benefit, a friend, a relative, or even a coworker, because awareness is often the first line of defense. By liking, sharing, and subscribing to this channel, you help create a ripple effect of crucial understanding about conditions like pancreatic cancer. No matter how small that action seems, the collective impact can be profound. Moreover, leaving a comment or question below can open up important discussions, connecting you with others who may have experiences or additional insights to share. Your engagement can foster a community of support and awareness that ultimately empowers individuals to take control of their health outcomes. In closing, let this be a reminder that your body has ways of communicating with you. Persistent symptoms are messages worth heeding, and early detection might be the difference between facing dire challenges and having viable treatment options. Pancreatic cancer does not have to be a silent killer if we collectively learn how to spot its warning signs and encourage others to do the same. By being proactive and informed, you stand a better chance of protecting your health and supporting those around you who may be at risk. Thank you for taking the time to explore these vital insights with us today. Remember that knowledge is power, so stay educated, stay curious, and most of all, stay vigilant. Your health and the health of those you care about depends on it.